Who is an art therapist? Art therapy is a mental health profession that enriches the lives of individuals, families, and communities by employing the active making of art, the creative process, psychological theory, and a psychotherapeutic relationship. Art therapists are qualified professionals, usually a master's degree or higher. They are trained in both art, e.g., painting, sculpture, working with art materials and media, and psychological theory. They are therefore primarily an academic psychologist. Who can benefit from art therapy? Art therapists work with people of all age groups, children, adults, seniors, and in a variety of settings: hospitals, schools, private practices, community centers. The method has been used for people experiencing trauma, depression, grief, autism spectrum disorder, Alzheimer's disease, schizophrenia, and other conditions. The goal of art therapy is not to produce beautiful art, but rather to provide a platform for self-expression, emotional processing, healing, and psychological growth. Research has shown that art therapy, when used alongside psychotherapy or cognitive behavioral therapy, can help with mental health. Many studies have also reported reduced anxiety, improved emotion regulation, increased self-esteem, and improved coping skills after art therapy. The creative process can distract the mind from intrusive thoughts, reduce anxiety, and promote presence and calm in the now moment. Why art therapy may be effective? Art therapy is effective not just because art is pleasurable, but because the creative process allows for nonverbal expression, discovery of meaning, emotion regulation, and stress reduction. Art therapy is not an art class. An art therapist is not simply an artist, but a professional with knowledge in both art and psychology, a person who is trained to use art as a therapeutic and supportive process. This distinction from art class is very important. Art therapy process. Art therapy uses creativity as a tool for healing. Clients express their feelings, thoughts, and experiences, often those that are difficult to express verbally, through visual arts such as painting, drawing, collage, etc. The art therapist and client then review the works together, seeking meaning and insight, regulating emotions, and discovering strategies for coping with anxiety/pain. Possible risks. Although art therapy can have significant mental health benefits, it is most effective when done under the supervision of a trained and certified art therapist in a safe therapeutic environment. Without professional guidance, simply creating art may not be able to reach deeper emotional layers, or may even activate painful memories/emotions without proper support. Therefore, the presence of a trained and qualified art therapist is essential to design, guide, and interpret sessions, to both maximize the effectiveness of the treatment and minimize risks.